Dizziness, giddiness, vertigo, unsteadiness, swimming sensation, feel like I'm gonna fall, I'm feeling disbalanced. There are so many different terms that people use when they are talking about balance issues. It is one of the most complex things in ENT to understand, identify, and treat. And that is what we're going to talk about today. This is an extremely important topic, and if you think about it, I can bet you know somebody who has balance issues. So let's talk about it. Let's talk about how to identify what is dizziness, what is not dizziness, what is giddiness, and all that kind of stuff. See you in the next section. Namaskar. This is Dr. Bhattacharya ENT, and I am Dr. Diptarka Bhattacharya. So let's talk about vertigo. When you walk into our clinic with complaints of unsteadiness and any of the other terms that people use, my first question to you is to understand what's going on. Usually when someone walks into me and tells me that they have balance issues, the first 5 minutes I am not even saying a word, because I'm hearing them speak. I'm trying to understand everything, every single thing about this, because this is a very, very, very important thing to understand. So the first point that your doctor needs to know is that when you felt dizzy, was the room spinning around, or was it just like unsteady? Did you feel like you were on a ship and you couldn't find your balance, or did you feel that everything was spinning? Now that is very important. Why? Because the spinning sensation is also called type 1 or true vertigo, and that can only happen if there's a problem in the balance organ of your ear. All other kinds of dizziness or giddiness happen because of the brain, because of muscles, because of eyes, all these kind of things, but they all cause unsteadiness, a sensation of falling, a sensation of a sensation of being pushed to one side, but only situations like the balance organ, or in some cases the brain itself, can cause true spinning vertigo. So that is number one. Next things that we want to identify is specific histories, like how often do you get it? Once you get your vertigo, how long does it last? Does it make you vomit? Do you have nausea? Did you ever fall? Did you have a fever at that time? Did you have a hearing loss? Do you have a pain inside your ear? There are all these things that we're trying to understand, and it can feel very confusing and perplexing to you. So let's take a step back and let's break down what exactly is vertigo and why are you getting balance issues. So let's take a look at that in this next section. So as you can see, how does your body keep you balanced? Well, this is an interplay of multiple factors. Number one is your eyes. Your eyes tell your brain whether you're walking straight, or you're turning, or you're going up or going down. The second is the muscles in your back and the muscles in your legs. These muscles also send information up to the brain, telling the brain that, hey, this is what is happening. We are walking, we are sitting down, we are lifting our leg, all that stuff. The third thing that plays a role is the balance organs, as you can see here, which sit behind the ears. These balance organs also give you information whether your body is moving up, down, right, left, or turning in any direction. So your brain is like a computer. It understands all these different informations and it adds them up. And as long as all of them come to a perfect correlation, you're perfectly balanced. Dizziness is basically when your brain cannot make sense of it. So if one of them is giving you an understanding of, is telling the brain that you're moving up, but your eyes are telling your brain that, hey, I'm standing steady, you're gonna get dizzy. So this lets us understand that any errors in any of these systems can cause dizziness. So that's why dizziness is very, very complex, because anything can cause dizziness. Let's just break down the reasons in a really short summary. So the eyes, any kind of eye issues, any kind of inflammation, any kind of muscle abnormalities in the eye, any kind of weakness in the eyes can cause you to get dizzy. The muscles, if you have cervical spine issues, well, the outflow, the signals that your muscles are sending the brain are not reaching because there's a block. And you turn your head to one side, or you look down or look up, or you sit staring at the screen for a long time, your muscles get tensed up and you start getting dizzy. Those are called cervical spine dizziness. You can get dizziness or unsteadiness with many other things, just general weakness, hypothyroid issues, any kind of things like that basically reduce the tone of the muscles can also cause dizziness. Finally, the brain. Anything in the brain can cause you to feel dizzy. If you get low blood supply to the brain, well, your brain can't add up all the information. You get dizzy. If you get too much pressure in the brain, well, you get dizzy. If your brain is inflamed, well, you guessed it, you get dizzy. So anything that messes up the central computer can cause you to feel dizzy. And now we come to the last part, which is the balance organ. Any issues in the balance organ can also cause you to get dizzy. Inflammations, tumors, metabolic abnormalities, electrolyte problems, anything in the balance organs can also get you dizzy. So if you understand that, the next process is very simple. There is no one magic doctor for all kinds of dizziness. As an ENT doctor, we are seeing patients with dizziness first, but we always involve other specialists so that we can give patients a comprehensive care. So please understand, dizziness is always a team approach. There are no heroes in this. I manage only the balance organ. We work with neurologists who manage the brain. We work with orthopedicians who manage the spine. We work with physiotherapists. It's a huge group of people, and everyone doing their job correctly means that we can get to the diagnosis more often than not, and we can get patients cured and great results. So when you walk into our clinics complaining of dizziness, the first thing your doctor is going to do is we're going to try to understand what's going on. And if I find that this is related more to the brain or the spine or anything else, then most of the times our first step is to refer you to the right doctor. Now, let's assume that after listening to your history thoroughly, I feel this is related to the balance organ. Well, the next step is usually to do a full workup. That means we do a set of tests to identify every small part of the balance organ and to see which one is being affected. Now, most of the times these tests can be done in one day, but they need usually specialized ENT centers who have all the equipments to do these tests. So once we got the results back, we can usually identify it, we can go over the test, and we get you an idea about what is causing it. Some of the most common reasons that people have this is either something called BPPV, or benign positional paroxysmal vertigo. This is a situation where some crystals which sit inside that balance organ basically fall out and go to other compartments. And let me explain that really quick. So the idea is that you have a gel that sits inside your balance organ, and you have little crystals that are floating in the gel, and the nerves sit under that gel. So when your brain moves up, when your body is moving up, the gel and the nerves move up, but the crystals are free, so they don't move up. They fall through the gel and hit the nerve, and that's how your brain knows that you're moving up. In some compartments, the gel is like this and the crystals are like this. In some of them, the gel is like this and the crystals are like that. And basically, that's how your brain adds X, Y, and Z axis, and that's how we identify how balance works. If some of these crystals fall from one compartment into the other, obviously they're gonna stimulate the nerves at not appropriate points, and that's how you get dizzy. This is very simple to fix. Most of the times we basically reposition your head in a specific set of movements. These movements are usually called either Epleys or Siemens or different kind of stuff. And once you've repositioned them, we usually do some rehab just to make your balance system heal up. And that's pretty much it. Most of the times that alone is enough. Sometimes we have to keep checking it so that it doesn't keep happening. Other common causes that we see people with this is either a small infection in the nerve of balance or hearing, And again, these need to be identified. These are usually much more violent vertigos. These are spells that last for 1 or 2 days, usually cause vomiting, usually completely cause that person to be lying in bed for days, and these need to be tackled early. Sometimes we keep the patients admitted in the hospital for 24 to 48 hours so we can give them IV fluids and steroids and all that kind of stuff to stabilize them. There are other things that can also cause dizziness or vertigo, things like Meniere's disease, which is basically a situation where there is excess fluid that is formed in the balance organ, and that pressure causes dizziness. There can be other viral infection, bacterial infections, and many other things that can cause vertigo. So with our balance testing, once we get to an idea, we usually treat it either with repositioning if that's the thing, or with medicines if that's the right approach to treat it. Now, to come to the last point, sometimes we do these balance tests and we find that your vertigo is not at all related to the balance organs, but they're related to the brain, and these are called central origin vertigos. These central origin vertigos are more difficult to treat because they may be associated with an old stroke. They may be associated with other metabolic diseases that you may have in your brain, and most of the times we work with the good neurologist who's trained to identify and treat these diseases and take care of these things. So to sum up, team approach, testing, identifying what is going on, and keeping a close watch on the patient is usually the right way to go about these things. So to sum up, vertigo or dizziness is a very common thing. If you are suffering from vertigo or someone you know is suffering from it, this is something that definitely needs to be looked into because people are at high risk of falls and injuries related to vertigo. If it's a spin-in kind of vertigo, most likely it's an ENT issue and you should see an ENT doctor. If it's basically unsteadiness or just weakness, then most of the times your neurologists or general physicians or orthopedicians should be able to help you. ENT surgeons are a good first point of contact. Any good ENT surgeon works with good neurologists, orthopedicians, physical therapists, and works as a team to treat vertigo because no one doctor can treat all the different causes that can cause vertigo. Hopefully this helped. If you would like to know how we can help you, you are always welcome to go to our website below or come into any of the physical locations so I can take a look at you and help you out. Please go ahead, like, subscribe, click on, I assume that's a bell icon, that notification thingy, and then I'll see you for the next video. Take care. This is Dr. Bhattacharya.